Okay, so today we're going to work on how to manage a nosebleed. So we have a patient, we enter the scene safety, BSI donned, we have our gloves and our eye protection on, come in, introduce ourselves, speak with this patient as they might be in some distress, as any kind of bleeds could be distressing to the patient. So we have a situation where we have a nosebleed here, so what we want to do is first of all set the patient up into an upright sitting or standing position, and we don't want to push their head back. We want it to be forward. This helps protect the airway from any secretions from the blood, or specifically in this case the blood that's coming from the nose that could obstruct the airway or cause discomfort in the stomach. So we want to have them facing forward. We want to apply direct pressure to the soft part of the nostril, so right at the nares, and then we want to pinch with distressing. We're going to hold pressure for about 5 minutes, ensuring that we are going to check and reassess every 5 to 10 minutes while holding pressure for those 5 to 10 minutes, depending on the severity of the nosebleed. We want to check for bleeding. We want to also make sure, again, initially when we show up, the patient's airway is patent as it is, especially if they were maybe laying down and having the nosebleed. We don't want any secretions to obstruct their airway. And so assessing that airway right when we get in to the scene, the AVCs always should be done first, and then secondarily we're helping them face forward, applying that direct pressure to the soft palate for 5 to 10 minutes at a time, reassessing the bleeding every 5 to 10 minutes, and then also reassessing the airway and ensuring that that patient's airway is still patent and not obstructed in any way by the bloody secretions coming from the nostrils. So that's how you would help a patient who's experiencing a nosebleed.